Oh boy. All right. We are live. We're live here. We'll be live on Facebook and Instagram shortly. We get to watch everybody come into the rooms and get this chat going on, get this really amazing. It's going to be a fun webinar tonight. Dr. Bruyette, I'm excited to talk tonight.
Great. Excited to be here.
Thank you. We're really glad to have you. This is going to be, kind of an all over the place conversation, I think, because I'm looking through the questions that we've got, and there are a lot of amazing questions that we want to get to. So we're going to try to get to them. So I see you guys are logging in here. If you have any questions, you can post them down there in the comment box, and you can let us know what you are wondering about feline diabetes, and we'll try to get to it. So this is an exciting talk. So before we get, too far into the conversation, I want to introduce our guest first and foremost. Dr. Dave Bruyette, you are not just a veterinarian. So you are specialized, you have board certification in internal medicine. Can you just kind of explain a little bit about just what that is in general?
Sure. Well, first of all, thanks for having me here. It's exciting to talk about diabetes during Pet and Diabetes Month. So you can specialize in veterinary medicine. So basically, after your 4 years of college and 4 years of vet school, you can choose to specialize in a given field. So I did a 1-year internship at Purdue University and then a residency in internal medicine at the University of California, Davis. And then you pass a series of tests and you become board certified in internal medicine.
It's a lot of work.
It is a lot of work, but it was a lot of fun. So
yeah. Mm-hmm. So there's a journey for every veterinarian, and I love to ask vets that I talk to, were you, born with a stethoscope? Did you know you were going to be a vet your whole life? Because most of the vets I know did.
Yeah, no, I did not know I wanted to be a vet my whole life. I grew up with cats. My family was very cat oriented. We never had a dog. I still don't really understand dog psychology or why you would want to have a dog, but there you go. I have a dog, but that's my family's choice. I got interested more in physiology and medicine, and was, looking at, well, should I become a vet? Should I become a real doctor? Decided I didn't really like people that much, that, I think if I was going to apply my medical skills somewhere, it should probably be for dogs and cats. So that's how I ended up in vet school.
And so at what point did you decide internal med's your jam?
Well, pretty much immediately, because internal medicine's basically problem solving. It's like putting together a puzzle. So, once you understand what's normal, and how normal works, then trying to figure out what's abnormal is a lot of fun. And, hopefully for a lot of the diseases that I'm interested in, which is endocrine type diseases, diabetes, thyroid, adrenal problems, those are diseases that unfortunately most pets live with for a really long time, which means the owners live with it for a super long time. And a lot of what we figure out pretty early is that as veterinarians, we're not just treating the dog or the cat, but we're really having to treat the owner, because the owners are, severely involved and intimately involved in this whole thing. And that really is highlighted with diabetes, because it's a lot of work. We had a diabetic poodle in our family for 14 years, and giving insulin twice a day, doing blood glucoses, going to the vet, making sure they're eating, not getting ketoacidotic. It's a lot of work. And I think it's a balance for us, trying to make sure that we don't scare the people off and make them feel like it's too much work and they can't do it. We can design a therapeutic protocol for a cat that makes the cat happy, gives the cat a good quality of life, but also gives the owner a good quality of life.
Yeah, that's such a great point. So I'll say this: you are absolutely right. Internal medicine is like the CSI of the veterinary world. Right. You guys are really have to take all the clues and put it together. And I think that can be incredibly frustrating for clients because they really want just like an answer. Like, why can't you just run the test and get the answer? And a lot of times
Right.
it's a process of ruling out. And I think feline diabetes is one of these cases where it may look cut and dry, but I also think it ends up in internal medicine a lot because, like you said, you love endocrine diseases. Like, God bless
Hmm.
you, because most of us don't. I think they're really hard to understand, right?
Right.
And they're really hard to regulate. And especially with diabetes, things are changing all the time. Insulin availability, it takes a ton of follow up, a ton of time. And so, when it comes to internal medicine, you guys are a very special bunch, and we thank you for taking those cases off of our
No
hands.
problem.
Because also, like you said,
No
it's a
problem.
lot of monitoring. So I want to kind of start there.
Yeah.
How do you have the conversation with clients when you walk in the room and you're ready to talk about a diagnosis of feline diabetes?
Yeah, no, it's a great question. I think that, the first thing we want to do is walk them off a ledge, because owners of diabetic cats and diabetic dogs, a lot of times they may be diabetic or they know somebody that's diabetic. And so they have this preconceived notion of, well, these are all the bad things that are going to happen to my diabetic pet. We know that diabetes in humans is a significant health problem. It's the number one cause of acquired blindness. It's the number one cause of stroke and heart attack. It's the number one cause of renal transplantation. It causes small vessel disease, so people can lose extremities and have amputations. It causes large vessel disease, so people have stroke and heart attacks. The first thing we have to tell diabetic cat owners is that none of that's going to happen, that your cat's not going to get any of those diseases. Cats don't get cataracts. They don't develop retinal or other eye issues that will cause them to go blind. They don't develop small or large vessel disease. It's not going to cause them to go into kidney failure. So, the things that we really have to manage with cats is that, first and foremost, we want to manage them so we can get rid of the diabetes. So the best way to treat diabetes is to treat it really aggressively up front, get it to go into remission and get it to go away. And if we can do that, everybody's happy. If we can't do that, then we want to come up with a therapeutic kind of plan and a dietary plan that allows the cat to have a pretty normal life and the owners to have a pretty normal life. And I think for the most part, that's very, very doable. So I think first thing you want to do is walk them off a ledge, let them know it's okay. We're going to shoot to make the disease go away, but if we can't, we're going to make it a very manageable chronic illness.
Okay, so that's a great place to start because we had an Instagram follower post, what are the chances of remission? So let's dive into remission a little bit. When can
Yeah.
we get there? How do we get there? And what are the chances we get there?
Yeah. Well, it's really good. And for those people who want to know more about what I'm about to go through, I think if you go to DVM 360, there you can just enter in the search cat and dog diabetes. We just posted an article on there today or a few days ago that talks about this. So what are the chances of remission in a cat is actually, it's quite high. So we know that diabetes in cats, it's multifactorial for sure. But one of the things that drives diabetes in cats is obesity. And the other thing that drives diabetes in cats is that they have a genetic weirdness, peculiarity to them, and that they're predisposed to diabetes because they develop this thing called amyloidosis of their pancreas. So their pancreas, the insulin producing cells in their pancreas get destroyed by this amyloid. So with respect to, talking to an owner or talking about remission, we know that if we take a newly diagnosed diabetic cat and we switch their food, and what we want to switch them to is a high protein diet that's low in carbohydrates, because cats as a species are not really genetically able to handle high carbohydrate diets. And we think one of the reasons why we see so much obesity in cats today is because a lot of cats are fed commercial cat foods. They're fed ad lib, so people just leave the food out. And cats, they got nothing else to do all day. They're just going to frickin' eat. So they just keep eating all these carbs. They don't know what to do with the carbs. They can't produce enough insulin to deal with the carbs, and it causes diabetes. So what we do is first is we talk to the owner about switching them to these high protein diets. high protein diets, when fed to ideal body weight, not free fed so they can eat as much of it as they want, but a high protein diet fed to what their ideal body weight should be lowers insulin resistance. It makes it easier for their pancreas to work. And that means their pancreas can start to produce enough insulin that they will no longer become a diabetic. So the first thing we're going to do is switch food. And then the other thing we're going to do is we're going to start them on insulin. And there's been a lot of work in the last few days or last few years about what's the best insulin type. And there's a lot of opinions out there, but I think the reality is the best insulins for diabetes in cats, especially to obtain remission, are what are called basal or long-acting insulins. And the one that most pet owners are probably familiar with is glargine. So glargine insulin is what's called a basal insulin. You don't get these spikes in insulin and a drop in glucose, kind of stays flat and boring throughout the day. That helps reverse a lot of the glucose toxicity that occurs in cats. So if you take these cats, and eventually I'll answer the question, if you take these cats and you put them on high protein, low carb, and you put them on a basal insulin, you got about an 80 to 85% chance that you're going to get remission of the diabetes. And that diabetic remission should occur in the first 60 to 90 days of making those two changes.
Wow. So, I think the idea that this is reversible is pretty amazing. Now, let's talk about the other 20% that are not reversible. Tell us more about when. Is it after we try? Is there a time, ahead of time, like this is where we're at? Is there like the type 1 versus type 2?
Yeah. Well, I think all really good questions. If you have a diabetic cat now, and he's been diabetic for more than 6 months, because he's been treated with whatever medications or diet he's been treated with, and the diabetes is not resolved in a 6-month period, there's essentially no chance that he's going to go into remission. So what that usually means is that the changes that have occurred in his pancreas that affected his ability to produce insulin are now irreversible changes. And so he's going to be an insulin-dependent diabetic for the rest of his life. But if the diabetes is recent onset and he's never been treated with diet or treated with an insulin preparation, then we have a really good chance of inducing remission.
For our kitties that we can't get into remission, what's their quality of life?
I think it's really good. I mean, we want to do things like we want to monitor how much they're drinking, how much they're urinating, how much they're eating, what's going on with their body weight. But again, because they don't get all those nasty long-term side effects that people run into, I think for the most part, their quality of life is pretty good. And we have owners who are really good at doing blood glucose measurements. We have owners who are really bad at doing blood glucose measurements. It's nice to be able to do it. I think it improves glucose control if you can do it. It's really, really important to do it if your goal is remission. It's really hard to induce remission and not know what the blood glucoses are doing. But once your cat gets on a fairly stable dose of insulin, even if he doesn't go into remission, if nothing else new happens to him, then it should be relatively stable. And his quality of life should be quite good. Most cats tolerate insulin injections quite well. So yeah, I think that they do well.
All right, let's dive into 2 questions you touched on there. Melissa Solo is asking more about that monitoring process. How can you do it? And what do you do to, like, what's that process look like?
Right. So you're really not monitoring the insulin level. I mean, you're monitoring their blood glucose response to a given dose of insulin. I guess, can you monitor you can't monitor your cat's glucose levels without measuring blood glucose, but you don't have to monitor the blood glucoses all the time if the cat is doing clinically well. I think the real push to do at-home blood glucose monitoring is in the beginning when we're trying to push for remission. But if your cat's in remission, you're clearly not having to do any glucose monitoring. If your cat's going to be a permanent diabetic, we want you to monitor the glucoses, but you don't have to do it that frequently. So it's not like a human who takes, a blood sample from themselves 4 or 5 times a day. That's not a requirement. We like to measure blood glucoses if anything weird is happening, like your cat's not feeling well or there's a change in some of the symptoms. And we like to measure their glucoses after we change something like diet or insulin dose. But it's not something that has to happen on, or like, let's do it every month. There's not really a good rationale for doing something like that. But whenever anything changes, it's super important to be able to measure the blood glucose.
So tell us a
And
little
it's
bit
easy.
about what that. Yeah.
People get, yeah. There's two ways you can do it. So one is sort of the traditional way where you get a blood sample from your cat. You can get blood either from the lateral ear vein that runs on the course of the ear. Most pet owners can see that. Or you can use it on one of the pads on the feet, the non-weight bearing pads. So the pads that are sort of up here, high up in the wrist. Most cats will tolerate taking blood samples from either of those locations pretty well. We always recommend that you use the lancets, the little device that comes with a lot of these glucose monitors, because those are designed to be very sharp and very fine. So most animals don't object to being poked in order to get that blood glucose. The other way you can do it is something that's more recent, but is very helpful. And that's a device called a flash glucose monitor. And these flash glucose monitors are a device that we put on the cat, on the back of the cat. Usually the veterinarian is going to apply this in the clinic. And then that device will measure the blood glucose as many times as during the day as you want to measure it. And then you hold your iPhone or the measuring device that comes with the kit over the top of the sensor, and then you'll see the blood glucose reading. So those sensors, once you put them on, work for 14 days. So you can check your cat's blood glucose 100 times a day if you want. You get 14 days before the sensor starts to run out. But the nice thing about the sensors is you're not having to take a blood sample. You're not having to poke your cat in order to see what's going on. So a lot of owners really like those. And I'm sure a lot of cats like those things because they're not having to get stabbed.
So you mentioned a little bit about at-home testing in the beginning.
Yeah.
Talk a little bit to that point, and in terms of like, I think a lot of veterinarians are still doing in-hospital glucose curves, and a lot are not. So talk a little bit about your recommendation, because I think I'd love to have our folks educated on how to have that conversation with their vet.
Yeah. Well, there's no question that if you look at blood glucose numbers that are generated in the hospital versus blood glucose numbers that are generated at home, the numbers generated at home are more accurate. And the main reason for that is because cats are unique in their physiology. They have something called stress-induced hyperglycemia, which just means any cat that gets stressed, just from simple things like traveling to the vet or being restrained for a blood sample, they're going to release a variety of hormones that cause their blood sugars to become elevated. And so if you're doing in-hospital curves, those blood sugars are going to tend to be much higher than the blood sugars we get with at-home monitoring. And then if you make decisions about insulin dose based on the in-clinic blood glucoses, you may be overestimating what's actually going on. So both in cats and dogs and in people, you're always better to look at blood sugars that are being obtained at home. Now, if it's completely impossible to do that, your cat just won't allow blood samples to happen and you can't get the flash glucose system to work, or for whatever reason that's not going to occur, then the second best way to do it is in the clinic. But as we mentioned, there's caveats to that.
Yeah. I'm glad you brought that up, because I'm actually like a huge advocate of in-home lab testing, because I feel like we just will never get those accurate answers. And even our guideline manuals and reference ranges are based on pets on a stainless steel table. And so I love that progressive thought. One thing I want to mention, there's a great question here I want to bring up. Can you talk a little bit about the points between glucose and fructosamine testing, and how can a client know which way to go there?
Yeah, well, they're two different things. So one isn't a substitute for the other. Fructosamine is a measurement of how much sugar is stuck onto proteins that are circulating in your blood. And so a fructosamine number that comes back from the lab tells you has your pet's blood glucose been higher than normal over the preceding last 2 to 3 weeks? But it doesn't tell you what's happening that day or what's happened in the last couple of days. So it's more of an integrated value over time. So the good thing about fructosamine is that we like to use it maybe 3 times a year or 4 times a year. And if we see that the fructosamines are going up over time, it doesn't tell you why they're going up, but it tells you that something's changing. Either the insulin dose needs to be adjusted, or there's something else going on with the cat that's causing insulin resistance. But it tells you, go look for the reason why that fructosamine is going up. A rising fructosamine doesn't mean give more insulin. There's a bunch of reasons why the fructosamine can go up. One of them is the blood glucoses are actually too low. And so if the cat spends a good chunk of the day with a blood sugar that's low, but then gets a big rebound in his blood glucose because now he's trying to figure out, he wants to get from a low glucose to a normal, he's going to overshoot. And if that's happening, the fructosamine will also rise. So giving more insulin will only make that worse. So rising fructosamine means something's changing. Go to the vet and let's figure out what it is. And chances are your vet, when he sees a rising fructosamine, is going to want to do a blood glucose curve to figure out what is happening.
Yeah. And then we're back at adjusting those levels, and that can be a good sign or a bad sign, right? Like that can be indications of remission because you're going to have to monitor that whole time.
So
I love that differentiation. Okay, so we've got some questions about, let's start with signs and symptoms. So what are we looking for when we're concerned about potential diabetes in a cat?
So the most common signs are going to be related to the high blood sugar. So in a cat, a normal blood glucose should be between like 80 and 120. Once the blood glucose starts to get above 120, and once it starts to get above 200, what you'll start to see is that eventually that blood sugar that's high now spills over and shows up in the cat's urine. So when their blood glucose gets high enough that the glucose shows up in the urine, that will result in the cat making more urine than normal. So one of the first symptoms of diabetes is going to be the cat's going to the litter box a lot. Then because the cat's urinating so much, he's going to have to turn around and drink a lot of water in order to keep from getting dehydrated. So excessive drinking and excessive urinating is probably the most common symptom that we see of diabetes. The other thing that owners will notice is that diabetes is sort of a disease of starvation, right? So if you don't have insulin, you can't use carbohydrate. So if you can't use carbohydrate, you're going to break down fat and muscle to make calories. And so what owners will notice is that their cat's crazy hungry, but despite that, he's losing weight because he's breaking down his muscle and he's breaking down his fat. So big appetite, lots of drinking, lots of urination, and weight loss are big symptoms of diabetes. And now obviously those symptoms are not diagnostic for diabetes because a lot of other diseases, kidney disease especially, can cause those same symptoms. But for a diabetic, when you see those changes, that's definitely a sign that you should go to the vet. And it's very simple at that point to determine if the cat's diabetic or not.
So interesting question here. Where do dilated eyes come in when we're talking about diabetes?
Good question. I would say there is no relationship between dilation of the eyes and diabetes. Usually cats, though, that develop dilated pupils, it kind of depends on what the next question that I would always ask an owner if I see dilated pupils is, can your cat see? Is he bumping things at home? Because they usually dilate their pupils because they're trying to get more light into the back of the eye. So we start to worry about things like, do they have high blood pressure? Because that's a common reason why cats' pupils dilate, is that they're hypertensive. And as their blood pressure goes up, the little blood vessels in the back of their retina start to bleed. And then the retina lifts off the back of the eye, and the cat now starts to lose vision. So if we see dilated pupils, we worry about blood pressure. So we're going to look in the back of the eye. And depending on what else we see in the back of the eye may lead us down another path, like something neurologic going on. But there's not a direct relationship between diabetes and dilation of the pupil.
Wonderful. Outstanding. Now we got tons of questions about diet and food and specific recommendations. And I know we don't want to talk about or endorse brands here, but I get this one a lot. Are Fancy Feast and Fancy Feast type foods okay to feed your cat, your diabetic cat at that? Especially if, well, one, there's a Facebook recommendation for it.
Yeah.
So what are your thoughts on that? Let's start there.
Well, let's just talk about it in general, first of all. So in this, irrespective of brands of foods or anything else, if you're going to prioritize what you should feed your diabetic cat, you want to feed it as much protein as you can and as little carbohydrate as you can. So the first sort of branch in the thing is most cats are going to do better on canned food than dry food. Dry foods, it's just really super hard to get a carbohydrate reduced dry form of a food. So canned foods are almost always better than dry food. When you get into the canned foods, what you're going to, again, look at is, again, the higher the protein and the lower the carbohydrate, the better. What she was probably asking that particular question is that there are, commercial diets that are out there that are formulated for diabetes. There's DM and MD from Hills and Purina that are formulated for diabetes. Fancy Feast, canned Fancy Feast is very similar in protein and carbohydrate composition to those types of foods. And Fancy Feast, we usually refer to it as cat crack. If your cat is sick and it won't eat anything, I give it Fancy Feast. If it doesn't eat Fancy Feast, then your cat's really sick. So, the Fancy Feast canned foods are going to be very closely approximate what most people recommend for diabetic cat diets.
That makes a lot of sense. And I always like to tell my clients, the best food is the food your cat will eat. So, you can buy these amazing diets, right? And if they don't touch them, then, so when people always get this like shame and they're like, I feed them Fancy Feast. It's like, it's all I can get them. I'm like, listen, there's nothing wrong with that. If that's the thing they want to eat and they like to eat it and you're meeting their calorie requirements, like, so settle down. And we know Fancy Feast offers 100 million different kinds of textures. We are a grilled house here. Oh my gosh, help us if it's not grilled. So another great question that ties into that, does it matter what kind of protein we're offering in this high protein situation?
Yeah, I would say that most of the data that's out there says that there's no difference between protein source. It really is just the fact that cats are basically obligate, carnivores. They enjoy protein. They eat for protein. So whether it's animal or vegetable-based protein, I don't think really matters as long as it is a protein source that's digestible. Horse hooves are high in protein, but not so digestible. So, you want to feed them a highly available, high protein diet. But yeah, protein source is probably not that critical.
Outstanding. So now this one is great. It comes down to, what about treats? Because we know treats are generally more carbohydrate based.
But cats, as opposed to human or dog, is that you actually want them to eat throughout the day. That you don't want to force a diabetic cat to eat 2 meals a day, one at the time of each insulin injection. They actually do better physiologically grazing throughout the day than they do with being meal fed. So I think it's fine to give treats. You just want to make sure and work with your veterinarian that as you're calculating how many calories a day they're going to be eating, that you take into account how many calories are going to come in the form of the treat. And if the cat wants to eat a lot of treats, maybe you just cut back on the amount during meals. But there's certainly nothing wrong with giving a treat to diabetic cats.
I love that, because the human animal bond there, right? Like, we want to be giving those treats.
Right.
So
exactly.
I like this question. I've got to get back up here to it because we have a lot of great questions. When you're talking to clients, there's a couple of these. Talk about administration. So for our viewers that do have diabetic cats, or for those that may face it in the future, how do you talk about giving injections and build confidence around that?
Well, I think, yeah, it's a good question, because a lot of owners, when we first diagnose their cat with diabetes, they say, "Oh, there's no way I can give a shot. Isn't there an oral medication? Can I give my cat a pill?" And generally, these are cat owners who don't really understand how much fun it is to give your cat a pill. So, we talked, and there was a lot of oral drugs to treat diabetes in people. Those drugs tend not to be very effective in cats, or they have side effects in cats. So I think most cats actually prefer to get insulin shots than to take something oral. What we usually tell people about the injections is that, the nice thing about cats is that they've got a lot of extra skin floating around. So there's a lot of space to give the shot. And we usually tell them, anywhere in terms of location for the injections, anywhere where you can feel a rib, that's probably a good spot to give. We know that if you go further back on the cat, past where the ribs end, that seems to be a more sensitive area for cats. Also, the more low you get, the more ventral towards their belly you get, the less likely they are to enjoy the insulin injection. So anything on the back, anywhere where you can feel a rib. And it's also probably a good idea to rotate injection sites. You're not always giving it in the same location. So you go left, right, front, back, so that the cat's not always getting that needle poke in exactly the same spot. For the cats that are treat motivated, it's always good, to distract them. So you can give them the treat while you're giving them the shot. And a lot of times while they're dealing with the treat, they don't even know that they got the insulin injection. So that's another thing that we'll often do, is just kind of distract them while that's happening. But in general, it's pretty easy. As you know, the best people to teach owners about how to give a shot is not the vet. It's going to be the technician who's going to be in the room and is going to explain all this stuff to them. So, we'll oftentimes have the owner give a fake injection, right? So they'll draw up the insulin dose with they're not drawing up insulin, they're just drawing up sterile saline. But it gives them practice with how to measure it, how to look at the syringe, how to invert the bottle, how to get rid of the air bubble, how to give the cat the shot. And most of the time when they get walked through that, then they feel a whole lot better about it.
Absolutely. I love that. You make sure they're practicing and they're comfortable before they leave.
Yeah.
I don't know if you're familiar. Do you know Monique Fairchild?
No.
So she has a company called Teaching Animals. She has a great YouTube video on,
oh, cool.
And it's on YouTube under Teaching Animals. It's a great video on the injection and the positive reinforcement and working them up to that by, just like a capped needle and a treat cap. And truly, you guys, when you follow through with this, your kitty will come running when they hear whatever that high value treat is. I also love to tell folks to get a really high value treat and only use it for injections. So they know this is the only time and the only way they're going to get this. I don't know what I listen, guys, don't judge me. Tiny little bits of spray cheese are one of my favorites. They take a little bit of a long time to get up, but Churu has kind of replaced that for me now. I wish I could get sponsored by Churu for how much I recommend it. What do you feel like are some tricks for treats?
In terms of what treats to give them, or?
Yeah.
I think it's like what you had mentioned earlier. I think it's whatever the cat values as a treat. Not every cat is the same. So, I'm fine with, this is my major dietary staple. So I'm a terrible person to talk to about food choices. But, I think for cats, if there's a treat that they liked when they weren't diabetic and you want to keep giving that to them, and that keeps them motivated and allows you to train them to do blood sampling or to give an injection, I think that's totally fine.
So this is a great question, a little bit off, curve, but do they get that sweet smell like people when they are having a diabetic imbalance, going on? Can they smell, the ketones?
Can the cat smell it, or can?
No, can an owner smell it?
Oh yeah, not every person can smell ketone bodies. So, some people can, and they, that is definitely, it has a unique odor if you have the right DNA to allow you to detect that odor, but not everybody does have it. What a lot of times owners will notice with respect to urine is not so much the smell, but that it becomes sticky. You can actually feel the sugar content in the urine or in their litter box when you go to clean it, like on the sides of the box, or after you're cleaning up afterwards, you'll notice that the urine's sticking there at the bottom. That's usually a sign that there's a pretty high amount of sugar in there.
That's great. That's outstanding. Here's a great question we should talk through a little bit. When a cat is on insulin, what does that look like? So Kathy says she has always learned you should wait before you feed the cat, and then so test shot, wait 20 minutes and feed. How do you recommend this pattern for your clients?
Yeah, I understand the logic behind that, and I think that makes a lot of sense. But the problem with that whole theory is that, one, I think it's just a pain in the butt, and it just puts too much work on the owner. And I don't know that there's much added benefit to it. The other thing I worry about is that if you give a shot and then the cat doesn't eat, then you have a much bigger problem with the potential that the blood sugar is going to go too low. So usually what I tell owners is feed your pet. If they're at the food bowl and they're eating, then just go ahead and give them the shot. Just combine everything into one. Plus, what we can do is, from a diabetic management standpoint, if we're always giving the same amount of food and the same type of food at the same interval and at the same time in relationship to the insulin injection, it makes what we have to do in terms of monitoring much easier, because the number of variables now is greatly reduced. Versus if you're changing foods, or you're changing amount of food, or you're changing the timing of the dose, then that makes it really hard to decide, well, what should we be doing here? Because there's too many things to take into account.
I like it. That's great. Okay, I think the last thing I'd love to talk through here, and it's come through in a couple different questions. For the kitties who do have a few pounds to lose, that can help them be in remission, how do you recommend exercise, diet? What are your recommendations around that? And how can they get their kitties up and moving?
Yeah, yeah. Well, I think up and moving is a tough one, because some of the one of the issues with cats that are indoor cats is that they tend to become pretty sedentary, and then when they tend to eat these diets that are high in carbohydrates and they can't really utilize them, we think that's a big trigger for diabetes. So again, the first thing you want to do is switch them to high protein. And then feed the amount of calories that's required to get them to their ideal body weight. And so this is something that you'll be talking about with your veterinarian, is based on your cat's current weight, and also the body condition score, which is also sometimes very important as well in terms of managing diabetes. But you're going to determine, well, look, I want my 18-pound cat, in a perfect world, based on his size, he should weigh 14 pounds. So you want 4 pounds of weight loss to occur in that cat. What you don't want to do is to have them go from 18 pounds to 14 pounds in a month. That's been shown to actually make things worse for cats, that it causes a big stress on their livers, and they may not be able to process that kind of weight loss that quickly. So I would say you want to get down to ideal body weight like over 6 to 12 months. It's a very gradual type of change. And the nice thing about that is it allows you to make the dietary switch and the reduction in the calories occur over a much longer period of time. Because cats really get super annoyed if their food bowl is empty, and they'll become quite harassing of you in order to make sure that that doesn't happen. But if we do the dietary restriction kind of gradually to get them down to that calorie count, I think they do much better. In terms of exercise, you're probably in a better position. That the thing that works for our cats more than anything else is a laser. They love lasers. My kids can exercise the cats all day long with the lasers. That works pretty well. But I think caloric, reducing their calories and making the calories in the form of high protein, I think will help a great deal.
That's outstanding. Yeah. Over at our Basepaws coach over at Coach My Cat, you can get a video one-on-one chat with me. And it's one of the things we talk about all the time. And it's as personal to every cat as it is an individual, right?
Sure.
Some people like running, some people hate it. So you're right. It's pretty awesome though, it's very rewarding. And I also remind folks with kitties to focus on non-scale goals, because it's ounces, and it's really, really hard to feel like you've done a big job when you've lost a couple ounces. But
Right.
one really great question here, I lied to you about it being the last one, is for
Okay.
our diabetic cat guardians, what is seriously low, and how do you recommend handling that other than immediate veterinary care?
Yeah, so I mean, there's a difference between having a measured low blood sugar and having clinical signs related to a low blood sugar. So many cats who are diabetic, who are on insulin therapy, their blood sugar could drop down below 40, 50, 60, and they show absolutely no symptoms. So if your cat is asymptomatic and has a blood glucose below 60, that's sort of the magic number where we start to get concerned. The first thing I would do is just feed them, offer them food, see if we can get them to eat something. For the most part, though, if they're asymptomatic, we don't get too alert or too concerned about that. Where we get concerned are the cats where their blood glucose goes down and they're starting to show symptoms. So they become weak, they become wobbly, and they're walking around. They may get dilated pupils. They may start to even have tremors or seizures. That's a life-threatening sort of an issue. If they're actively seizing, you really don't have too much you can do at home. You really just need to get to an emergency clinic. We usually tell people to have Caro syrup at home, very concentrated sugar solution. If your cat's alert enough for that, he doesn't have to swallow the Caro syrup. You just need to apply some inside his cheek, just get it into his oral cavity. They'll absorb it through their mucous membranes. Sometimes that can be pretty helpful. The other thing we can do, and we've done for cats where they've had multiple recurring episodes of hypoglycemia, is that the way humans deal with it is that they have a glucagon injector. So glucagon is a very potent hormone that raises your blood sugar within a few minutes. Veterinarians can write a prescription for a glucagon pen, and the owners just administer a fixed dose. They just take the needle or take the cap off the needle, give the shot, and that will raise the blood glucose within about probably 5-10 minutes, and it'll stay elevated probably for a few hours. So that's probably the most potent physiologic way to raise their glucose is with a glucagon injection. But other than that, we just recommend feeding, and if they're not hungry, then to do the Caro syrup orally. But if they're not alert enough to take anything in their mouth, or if they're having active seizures, they really just need to go to an emergency clinic.
Yeah. For our kitties, you mentioned weight loss being an issue. And so there was mention too about that. Like, so if we know that a lot of diabetic cats kind of go into it overweight, and so they lose weight, but they still are generally not of an unhealthy low body weight. But what if they are? What are your favorite ways? Like, so often we hear like, oh, well, eat kitten food. So it's like, well, just eat a ton of fat. And I'm not sure that that's the answer. So what do you like to tell your clients?
Well, yeah, I mean, fortunately, you're exactly right. So the vast majority of cats that get diagnosed with diabetes have a history of weight loss, but they're still obese when they're being diagnosed. It's if you have a cat who's diabetic and they're continuing to lose weight, or they fail to gain weight back, like their body condition score is actually low, it's below normal, that's almost always a sign that something else is wrong with the cat. That's not a diabetes issue at that point. That usually means that there's another metabolic problem going on. His thyroid's out of whack. Maybe some kidney disease or liver disease, or he's got primary intestinal disease. But failure to go back to a normal body weight would be very unusual for a diabetic, and almost always means that there's something else wrong.
That's a great point. Okay, well, I think I have told you that was the last question enough times. Other than the questions we've covered, is there anything that feels really essential that we didn't cover and ask that you want to make sure owners of cats with diabetes would know?
Yeah, no, I mean, I think that, we've learned a lot about cat diabetes in the last few years. I think that some of the things, and, we're doing obviously a really cool study with Basepaws where we're trying to look at the genes that are involved and in creating a diabetic cat in the first place. Because if we understand what those abnormalities are, maybe it will help us tailor things, whether it's diet or lifestyle changes or therapeutics that can help decrease the incidence of diabetes in cats or help with the management. The other thing that pet owners may find Googling around, which I always warn people is like crazy dangerous. The Google search for diabetes can be quite scary, but we're looking at treatments for diabetes sort of beyond insulin. Cats have the ability to make insulin. They just go through this period where things are out of whack. So are there other medications that might be helpful? And so there's many drugs that are on the market for humans with diabetes that are non-insulin drugs that help support function of the pancreas and of those insulin producing cells. So I think you're going to see that those types of treatments are going to become more used and useful in managing cat diabetes. They might be more effective in inducing remission. They might be helpful in cats that are having problems with blood glucose control despite being on insulin. They may be helpful in terms of maintaining body weight. So I think we're going to be looking more and more at these novel non-insulin type treatments for cats over the next couple of years.
Yeah, the diabetic genetic study is really interesting, like really interesting. So if you have a cat with diabetes, you can click the link that we just posted and learn more about it. Honestly, we're going to change the world with these genetic studies. I really believe that. And we're going to be able to do amazing things. And speaking of amazing things, thank you so much for being here today, having this conversation, helping educate all of our cat owners who love their cats so much and want to be doing the right thing for sure. So you guys can, Dr. David Bruyette, where can they find you? Are you on Instagram? Where do you hang out?
Yeah, I've never been able to figure out Instagram, but I'm definitely pretty much everywhere else. So my email is david@anavive.com. You can reach me there. You can find me on LinkedIn or I'm on that Facebook thing. So any of those locations, but my probably the easiest way is david@anavive.com.
That's awesome. You guys can always reach out to us if you have any questions. We are so excited to learn more. We will have to have you back for a full dive into these studies as we develop and learn more. And again, thank you so much for your time. I hope you have a wonderful rest of your day. Thank you guys for watching.
You guys too.
Yeah, and we will catch up again with you guys soon. Thank you so much for being here. And I hope you guys all have a wonderful, safe night. Bye.
Thanks.